Bringing bad news to a patient is never easy. No matter the circumstances, it is important to treat this topic with sensitivity and caution as you want the patient to feel as comfortable as possible. When physicians fail to deliver bad news effectively, there may be many negative consequences for patients, families, and all providers involved. In this video, we will observe a detrimental way of delivering bad news to a patient, a beneficial way of delivering bad news to a patient, and discuss an overall summary of the topic at hand.
Hi,
Hello.
I'm Dr. D.
Hi, I'm Lydia.
So, what's wrong with you today?
I really don't know. I just haven't been feeling my best.
Yeah? So have you been eating well?
Mm-hmm.
The scans came back all right and everything?
Mm-hmm.
Okay. Well, I'm just gonna tell you, bad news. You pretty much have breast cancer.
What? I have cancer?
Well, yeah, it'll all be fine though, I can promise. I'll send you to my best medical oncologist. It'll work out. This happens to people, don't worry about it.
How?
You know, it just grows sometimes, nothing you can do about it. You'll be fine. We'll send you, get you treatment, get you some medicine, it'll be all right.
What have I done to get this?
I couldn't tell you that, I'm not sure, but it'll work out. Well, I'm sorry, but I have other patients to take care of. I'll give you the medical oncologist, we'll take care of you. Have a great day.
Hey, nice to meet you. I'm Dr. V. What's your name?
Nice to meet you, Lydia.
Lydia. It's nice to meet you. So, what brings you today? You wanna tell me any issues, concerns, problems? What led you to make this appointment?
I just haven't been feeling my best. I've been very sick recently.
Okay. Now when did you start feeling like this? How recently?
A couple months ago.
Okay, a couple months. Do you have any blood work that's been done that's revealed like any kind of anemia, anything like that, any genetic disorder, anything like that would affect your well-being? No? Okay. So regarding the scans that we did with you, I'll get to that in a little bit, but just wanted to ask you if you have any family members with any history of a disease that could be like cancer or anything like that.
My grandma had breast cancer.
Okay, breast cancer. Gotcha. Okay. Well, I wish I had better news to give you today, but it seems that the scans that we did for your breast tissue earlier did come back positive for an invasive kind of breast cancer.
I have breast cancer?
Unfortunately, yes, you do. Again, I apologize that this is the news that I have to give you today, but it does look like you have breast cancer.
Well, what do I do now?
So the next steps as far as breast cancer goes, we have a very well-fortified team of oncologists, medical oncologists here in town, one of the best. And we will get you on track with them immediately to start talking about treatment plans and make sure that you have the best treatment you could possibly have for where you are right now. And again, I know this is a shock for you to find out, but we have a very skilled team that will be willing to do everything they can to help you and your family just to combat this and get the best treatment you possibly could. Do you have any questions? Do you have any concern? I know this is a lot for you to take in at one time, but do you have any concerns, anything like that, as far as treatment goes?
I think I'm just in shock right now.
I understand that. And this is a really difficult time. And if you need to talk to anybody as far as therapy goes, as far as anything like that goes, we'd love to set you up with a team that would help you get through this together. Is there anything else that you need from me? Anything like that? No? Well, the next step will definitely set you up with a medical oncologist here in town. We'll make sure we set you up with appointments, treatments, and we'll get all of that worked out and try to make it as clean and as easy as possible for you to navigate, okay? if you need anything, you have my number, you have the staff's number here, and we'll be happy to help you through this, okay? But again, I apologize for everything
Thank
that I
you.
didn't tell you today, okay?
Breaking bad news from providers to patients is a very important yet fragile aspect of patient-provider communication. However, when the physician has adequate training in how to deliver this information effectively, with empathy and invoking an understanding among patients, these conversations can be transformative in the patient's healing process. The concept of delivering bad news relates to this phrase, "It's not what you say, it's how you say it." With the right tools, delivering bad news can be informative and helpful to patients. The only way for a patient to begin the healing process is through these important conversations.